14 causes of dementia. Did you know that recent research has confirmed 14 possible causes of dementia? Keep watching to find out what they are. Hi, I'm Dr. Knight and this is Getting On, the series where we stop worrying about getting old and just start getting on. Welcome to my memory series where we're talking about all things that can affect your memory. And today we're talking about possible causes of dementia. Recent research published in 2024 by The Lancet confirmed that there are 14 possible risk factors for dementia, and that taken all together, these 14 risk factors account for almost half, or 45%, of all dementia cases in the world. So what is a risk factor? A risk factor is something that happens to us or something that we do to ourselves that can increase our risk of getting certain diseases, and that includes the disease of Alzheimer's or certain types of dementia. Some of these risks we can't change, like our age, our sex, but some risk factors are what we call modifiable, which means that we can actually affect and change the risk. The Lancet, which is one of the oldest medical journals still in publication, recently released research in 2024 reviewing the latest evidence in dementia and what we can do to reduce our risk of developing it. The Lancet essentially looked at loads of studies that have been done across the world and pulled together all of that data to come up with one cohesive set of observations about dementia risks. So they've come up with a list of 14 things which can officially increase your risk of getting dementia. The report says that these next 4 risk factors are linked to the greatest proportion of people getting dementia. Those 4 things are hearing impairment, high cholesterol, less education in early life, and more social isolation in later life. So those are the 4 main contributing risks. But what about the other 10? Well, the others include air pollution, traumatic brain injury, depression, high blood pressure, obesity, diabetes, physical inactivity, smoking, excessive alcohol consumption, and uncorrected visual change or loss. So dementia is more common in people who have one or more of those risks. So here's how risk works. It doesn't mean you'll get dementia, even if you have every single 14 of those risks. And it doesn't mean that even if you don't have any of those risks, you definitely won't get dementia. That's because there are lots of other things at play, for example, your genetics, and non-lifestyle things that might have happened to you even when you were in the womb. But this research does show that there are things that we could do to help reduce our risk of developing dementia by addressing those 14 things. Just as a reminder, which I keep banging on about if you've watched my other videos, but aging does not mean that you will automatically develop memory loss or dementia. Just getting old does not mean you should be getting dementia. Sadly, some of us will get dementia, but there are things that all of us can do to help reduce our risks of developing it. So what can we do to help lower our risk of getting dementia? Well, based on the 14 risk factors that I've spoken about today, we know that there are some things that we can do to help reduce our risk. And those include eating a lot better, socialising well, so staying connected with friends and family as we go into older age, and avoiding social isolation, managing our health, so in particular paying close attention to our blood pressure, so if you've been diagnosed with high blood pressure or hypertension, making sure that it's well controlled for as long as possible throughout your life, making sure we have regular vision and hearing checks. If we have hearing problems, making sure we're wearing hearing aids. If we have vision problems, make sure we're wearing those glasses that we were given, and making sure our cholesterol isn't too high. And then the more boring things, making sure we do regular exercise, avoiding smoking or drinking alcohol. So basically all the things that we're told about for our general health anyway. And then extra things we can do to help our brain health is keeping our brain really engaged. So doing things like word puzzles or crosswords, and basically always challenging our mind. And also, quite importantly, avoiding head injury or head trauma, which hopefully we try to avoid anyway. It's never too late to start making improvements, but the earlier you start making improvements, the better chance you're going to have of keeping your brain nice and healthy to try and reduce your risk of dementia. Even if you do develop dementia, research shows that actually addressing these risks even once you've developed dementia can slow down the process of it, and so it would still mean that you'd stay healthier for longer. So those are the 14 risks of developing dementia according to the Lancet research published in 2024. If you want to have a read of the Lancet publication yourself, I would urge you to go ahead and do that. Another really good resource in terms of dementia and memory loss is Alzheimer's Society or Alzheimer's UK. Check out the description below for the resources and watch the rest of my memory series if you're interested in finding out how to help improve your memory. Thanks for watching. See you next time on Getting On.